So I defined incontinence in short one, where we talked about incontinence being a loss of control of bladder function, and the types meaning urge, stress, or overflow. So looking at our anatomy here, it's important to understand the why. Why does urge incontinence happen? What is it? What is overflow? What is stress, right? So when we talk about these types of incontinence, when we think about stress, for instance, stress meaning that the incontinence here and the stressor doesn't have to necessarily be disease related. So the patient says, oh my gosh, I cough and I'm leaking urine. Or, achoo, I sneeze and oh, I'm leaking urine. So that is a stress, that core stress or movement causes leakage of the bladder. So that is an example of stress incontinence, okay? Urge is, wow, I have the urge to go, I gotta go, and I don't make it, okay? And then there is the overflow incontinence, meaning that the bladder is to its capacity and it's overflowing fluid or leakage of urine because it is not emptying properly. Understanding that in all of these, the bladder is a muscle. So this is the impairment of the muscle in different forms: stress, urge, or overflow. So again, I mentioned that urinary incontinence can have causes that aren't due to underlying disease. Examples: intoxication, unavailability of bathrooms, coughing, sneezing, extreme anxiety, or intense laughter. Stress, urge, overflow as types. So what do we want to do about it? We want to train the bladder. So across all of these shorts, I will always emphasize that utilizing drug or medication should be secondary. So oftentimes you'll read about Kegel exercises or training the bladder, training the muscle as if you would train the heart muscle or the brain, training the muscle to understand the voiding event. So what does this mean? So how do I control my urge to go? Well, I delay the event. I learn how to delay my urination whenever I have to go. So this explains why, oh my gosh, I'm in the middle of a concert, I'm enjoying this concert, but I have to hold it. I just have to wait till they finish this last song, then I'll go to the bathroom. That's delaying the event. Then there is a term called double voiding. This involves urinating, then waiting a few minutes, then urinating again, helping the bladder learn to frequently empty, okay? Having a toilet timetable. This is important for caregivers who are caregiving for an older adult that suffers from incontinence issues. So you schedule a bathroom break at set times during the day, for example, every 2 hours. This will eliminate the nighttime getting up and going to the bathroom.